What do we got today? I
Today-
read something about sickness, right? Is
Yes.
that part of?
This viewer request, Dr. Judi is answering a question from a viewer about morning sickness.
That's what it is. Okay, cool.
So do you have experience with morning sickness?
Yes, I do.
Tell me
Personally?
about it.
Every morning I come in, I am sick. No, I'm just kidding. No, yeah, I have a wife. I have 6 daughters. I have some experience in trying to be compassionate for those that have had to deal with it. So yes, I haven't experienced morning sickness.
What did you do to help your wife?
Number one for her and in our situation was stay clear as much as possible.
I see.
I
No,
like that.
seriously, no, it's like don't try to be the comedic. It doesn't work. You know, don't try to come up with just stay clear, and it is usually good. Am I way off base on that?
For a lot of women, that's true.
Okay, so for us, that was good. Yeah, because it's not a good time, and I
Mornings-
felt so bad I didn't know what to do. So
Morning sickness is what is the housewife's name for the nausea and vomiting of pregnancy.
Right.
And it is very common. It happens in up to 70% of women who are pregnant. But it's at various stages, and some women just feel a little nausea. It just doesn't feel good, and some women are so sick with vomiting that they can't hold any food or drink down, and that's called hyperemesis gravidarum. Whew, wonderful. But it is a very difficult thing to deal with, and no woman likes it.
Oh, horrible.
And the really interesting thing is, after all these centuries of women having morning sickness, they still have not discovered the cause.
that's what I was going to say. You'd think after all of this, they'd figure out what's going on.
I know
'cause
the
why do you have to-
cause. It's that little parasite that
Right. Saw that one coming. All right. Maria Carr.
Sorry.
That little,
However, they
little
have
parasite.
Okay, we better be quiet.
They have learned some things that make it worse. Number one, the more stress there is in the life, the worse the morning sickness tends to be.
So that
And
make it worse.
One of the
Stress.
things that you want to do to prevent is, as you're thinking about getting pregnant, if there's a lot of anxiety and a lot of stress, of course, sometimes you can't get that stressful person out of your life. But you can, if you need to get counseling or learn how to deal with the stress so it's not such an anxiety-producing thing, that would be something really important to do. So you don't want to do lots of stressful things like major moves and kicking husband out of the house and everything else right before you get pregnant.
So clear your schedule of all that stuff in anticipation of it,
Okay.
right?
Okay,
No,
good.
I mean, I'm not saying kick it. I mean, but if you know
Right.
that there's going to be stressful stuff coming up, try to get rid of it, right?
Well, or learn how to deal with it. If you don't know how to deal with it, get some counseling, get some help to learn how to deal with it. Another is low blood sugar. Makes it much worse, and that's why they say to eat frequently during that illness, eat carbohydrates, eat higher protein things, and have something in your stomach all the time so that blood sugar doesn't dip. But in preparation for pregnancy, eating a good healthy diet, getting rid of the sugars, getting rid of the simple carbohydrates, the cookies, the crackers, things like that, and eating more complex carbohydrates like whole grains and vegetables and fruits and a small amount of protein will help your body get ready for that.
Okay.
The first thing when you're morning sick, you want to look at diet. Often, nothing feels good, nothing sounds good. It's hard to think of what to eat. But the real important thing is to keep sipping, drinking, because you get much worse when you're
I
dehydrated.
was going to say, yeah, if you're that sick that much, you need to rehydrate yourself.
The baby does not have problems if you're not eating, because the hormones take the fat out and give it to the baby. But the baby does have problems if you're dehydrated. And the morning sickness also gets worse, and it becomes a vicious cycle when you're dehydrated. So if you're really having trouble getting drinks down, then talk to your doctor about getting an intravenous therapy at least once a week. Because you want to rehydrate yourself, and that can make a huge difference.
Important. Just so you know I make everybody sad when I say you only have 2 minutes, but just so you know, and if we have to continue it with a second segment, we'll do that, because this is really important.
So some of the things that have been found, the American College of Obstetrics and Gynecologists recommend taking multivitamin at the time of conception because that has reduced the level. Now, sometimes once you get sick, it's really hard to take a multivitamin.
Yes.
So you want to find liquids and things that you can take because often that pill makes it really difficult and people feel sicker. But taking vitamin B6, 50 to 100 milligrams, is recommended by them. And sometimes it can be added with an antihistamine called doxylamine, Doxylamine. The combination of that has been often found very useful. And some non-traditional forms that are even recommended by the American College of Obstetrics and Gynecologists is ginger. Ginger is an herb that is found often to make a huge difference. Now, be aware that when they say these things help, they usually don't take away all the morning sickness, but if it can keep you from vomiting, allow you to have a little bit of appetite once in a while, you've got to go on grades. I used to think, well, nothing works because nothing took it away, but what you have to look at is how severe it is.
Okay, we're out of time in this segment, so I think we need to continue it during the next segment because this is really important. I know there's a lot of women out there who are looking forward to this.